our topic is the prostate gland conditions or diseases that affect the prostate with the symptoms. And of course, the PSA issue, that is prostatic specific antigen. Now, where is the prostate? The prostate is just at the neck, or I would say just right below the bladder, in front of the rectum. Now, there are three main conditions that affect the prostate gland. The first condition is prostatitis. It's not too common. It is inflammation of the prostate. Normally is a urinary tract infection, maybe bacterial infection. You can treat it and reverse this condition very easily. But of course, the symptoms are very similar to other conditions. The second thing is the non-cancerous enlargement of the prostate. It's popularly known as prostate enlargement, but medically it's called benign prostatic hyperplasia or BPH. And this is, you can see, that is the most common case that affect or condition that affect men. And then of course we have prostate cancer that affect men too, but I can say is not as common. If you have 7 men, only one of them, 1 out of 7 after 50 years of age may have prostate cancer. But if you take 2 men after 50 years of age, 1 out of 2 men will have prostate enlargement. So you can see that prostate enlargement is really common, possibly followed by prostate cancer, and then followed by prostatitis. So if a man has the following symptoms, they shouldn't be worried because it could be anything. If we look at the common symptoms that affect both prostate enlargement and then cancer, let's listen to this carefully. In both enlargement, prostate enlargement and cancer, both conditions will show this. The man may have the urgency to pass urine, the urgency, and then that man may have a frequent urination at night and the day. It starts with 2-3 times, and then it will lead to 7, 8, 9 times at night. And then the man may also have difficulty passing urine. He may sometimes have to try to push to release. And then there will be some dribbling or, very thin streams come in, and then sometimes a split of urine. The man may also experience stop and start. The urine may come and then to stop, and then it will start again. And then there's a feeling that man hasn't emptied their bladder yet, so they try to push around. But you see, if we look at a prostate cancer, these symptoms are very specific for prostate cancer. And that is if you have all these symptoms, plus a man, if you have trouble getting an erection, apart from what I've mentioned, because the symptoms I've mentioned are for enlargement and then for the cancer, but you cannot be sure about what is specific for cancer. Apart from what I've mentioned here is an erection problem, burning sensation when you pass urine, and blood in your urine and then in your semen. And then there's less fluid when you ejaculate, and there's a painful ejaculation. So these are very specific for prostate cancer. But one may say, what about the prostatitis? Prostatitis may have also burning sensation too when you pass urine, and you may have difficulty too passing urine. And there's also urgency, and there's a cloudy urine. Cloudy urine, this is very specific for prostatitis. And that's specific for prostatitis, inflammation of the prostate, is that between the testicles or the scrotum and the rectum, that area is called perineum. There is always pain for that man. The man will experience the pain, and that pain also may radiate to the abdomen, the groin area, and then the lower back. So the man may feel that. This is very specific for a man. The man may also feel pain in the penis or the testicles. It's very specific for prostatitis, that's inflammation of the prostate. What about the PSA issue? But before the PSA, what causes it? Research has shown that there's no real known source of that, but they believe that is a hormonal imbalance. As men grow, their testosterone start going down and estrogen going up. So imbalance. The high estrogen in men can then contribute to cell irritation of the prostate cells that could actually start to multiply and not to obey any instruction, and that could lead to that enlargement problem. PSA, that's a prostatic specific antigen, is a protein produced by normal prostate gland, and also is produced by cancerous cells of the prostate. But so it's not conclusive. If a man goes to the hospital and there's a high PSA, research has shown that a man PSA even below 4.0 may not even have prostate cancer, or may have. And it's also known that men with the even low PSA may have cancer, and a man with a higher PSA more than 4.0 may not have any cancer at all, because anything can happen. If you have prostatitis, enlargement, or prostate cancer, all could produce high PSA. So man, do not be afraid. If you have a high PSA, they should do more specific tests so that they can get clear, some clarity there, and not to be anxious about that. All right. I hope this can clarify that myth going around and the issues of prostate enlargement and cancer and prostatitis. I hope we've learned a lot. If you want to learn more, you can go to my YouTube channel, put in Dr. James Natural Link, Dr. James Natural Link. Go there to subscribe and click the like button. And there are a lot of videos there. Share that, be a blessing to somebody. But take this number if maybe you have prostate enlargement or any chronic problems in your body that has been causing problems to you. And God will use me to bless you, to give you that healing, to unlock the potential healing power in your body. Calling outside the UK is WhatsApp number is +44 738 464 7300. If you're calling within the UK, is 0738 464 7300. Beloveds, thank you so much.